Democrats will take control of the House of Representatives on January 3rd, and taxpayers can expect a major push for total government control over the American healthcare system. Representative Pramila Jayapal, leader of the Medicare for All Caucus, is rewriting the House bill to make it look more like the Senate bill authored by Senator Bernie Sanders. Here's a look at what these bills would do. Both bills would outlaw virtually all private and employer-sponsored health plans that currently cover 181 million Americans. Millions of federal workers and their families who get their coverage today through the popular and successful Federal Health Benefits Program would also lose their health plans. Ironically, quote-unquote Medicare for All would also eliminate the Medicare, Medicare Advantage, and Medicare supplemental insurance programs now covering over 58 million senior and disabled Americans. And Medicaid and children's health insurance programs now covering over 73 million more would also be eliminated. So what would our healthcare system look like instead? The VA uses America's premier homegrown single-payer health system. And in 2014, CNN reported that veterans would languish and die because of the program's bureaucratically manipulated waiting lists. And you may recall the federal government's shocking record of poor quality of care for America's veterans exploded into one of the nation's worst healthcare scandals. Yet advocates of these proposals promise that total government control over American healthcare will secure higher quality care at lower costs. A look at Britain's National Health Service, the granddaddy of single-payer healthcare, shows that long waits for care is the perennial feature of the system. It's true, of course, that the British spend less than Americans on healthcare, but they also get less. In December of 2017, almost one-third of NHS regional directors reported that they were unable to deliver comprehensive care. And in January 2018, the NHS canceled more than 50,000 non-urgent surgeries, and British doctors charged that their patients were being subjected to third-world conditions. Historically, British survival rates for urgent medical conditions fall well short of America's performance. British patients have less access to advanced diagnostic technologies, such as MRIs and CT scanners. And on a per capita basis, they have fewer doctors and nurses than almost every other Western industrialized country. Medicare for all may sound appealing, but total government control of healthcare comes at a very high price, and not just in terms of money.